With that, I would like now to open up the next block, where we really turn to those leaders that have been at the forefront of this pandemic and hear from them what they think of all of these proposals that we have been making. The first person I'd like to introduce to you is Dr. Asma Awadh. And she is from the Nairobi Metropolitan. She's been leading the COVID pandemic in the big metropolitan area of Nairobi. And Dr. Asma, I know that you are always busy. Patients are always waiting for you. And I'm so incredibly grateful that you could spend this time with us. And we look forward to hear what you have to say. And the floor is yours, Dr. Asma.
Thank you, Professor Miriam, for the invitation. All protocol observed. Good afternoon to everyone. I'll take you through social inequality and challenges we face in the healthcare provision within Africa, and I've been to all East African borders. So you find most of the time the social inequality that we face in healthcare, vaccines, education, and employment can easily be addressed by just a collaboration in regards to education, science, research within the ministries or medical schools in Africa with more established other countries outside the African continent to produce vaccines or vaccines rollout. And you find this strategy most of the time will help reduce vaccine hoarding and vaccine and also bring about vaccine nationalism. And that's where the issue has been. If I might elaborate on some of the key challenges that we've been facing on the ground, you find there's a lot of capacity hampered by lack of resource to equip university with libraries that can actually be able to provide or manufacture these vaccines or educate. There's also issue of access to healthcare services, especially it was more overt during the pandemic where we had a lot of people who suffered from COVID or need to access healthcare services in regards to COVID were highly affected. Then the issue of brain drain of talent to the other country and migration usually due to reduced creation of opportunity in the African countries. So you find most of the time, if there's creation of opportunity in African countries, we might actually not lose most of our brains, African talent going outside to seek these opportunities. Reduce vaccination rollouts. In our setup, we found there was a lot of families that are affected. For instance, in the informal settlements, where they were hugely and hardly hit by the lockouts, and which subsequently we had a lot of lack of employment or loss of employment and livelihood. Had these vaccines been rolled out in good time, most of these jobs will have not been lost. The traumas that most of the people in the informal settlement had actually suffered from due to violence, and especially the women, we actually saw across Africa where there was increase of teenage or girl child pregnancy due to close out of schools because of the pandemic. And you find if vaccine had been shared equally across the globe, more life will have been saved. And having more resource allocation by donors and in partnership with the local planning can actually strengthen access to health and improve infrastructural systems. Thank you very much, Prof. Miriam. And I think I'll end there and hand over back to you.
Thank you very much, Dr. Asma, for a short but very pertinent presentation. Really appreciate it.